Hi, I'm Dr. Leon Scott with Vanderbilt Orthopedics in the Division of Sports Medicine, and we're offering a new procedure for individuals who have chronic tendinopathy. That's an overuse injury and process that takes place and leads to things like tennis elbow or jumper's knee. The procedure is called percutaneous ultrasonic tenotomy. So the purpose of these videos, or this video specifically, is to go over how the procedure works and to compare it to some of the other common treatments that are offered to individuals to see if it might be one of the better options for you. We percutaneously go through the skin and insert a ultrasonic probe, one that pulses about 20,000 times per minute, in and through the tendon, tenotomy, to treat and debride the diseased tissue. There's an interesting observation that many physicians see when it comes to chronic tendon issues, and that's that although the local area may be injured and may be a source of pain, that oftentimes we amplify the pain subconsciously from our brains. So one of the best treatments that we recommend for chronic tendon issues is actually time, because we see that even when individuals get a treatment or a fake version of a treatment, frequently the pain decreases at the same or even a better rate with the less invasive placebo. So that is one thing to be aware of through all of this. But if the tendon itself seems to be the main source of the pain, there are some conservative things that we recommend. Topical rubs, braces, oral medicines, physical therapy with strengthening, stretching, and manipulation at the tendon site. For conservative tools, some people experience about a 10% drop in pain, sometimes as much as a 50% drop in pain. What I mean by that is if you rated your pain as a 6 out of 10, you may get down to a 5 out of 10 or even down to a 1 out of 10 with those conservative treatment options. Outside of conservative treatment, sometimes we move to steroid injections. Corticosteroid injections are some of the best tools for dropping pain quickly, showing a drop in pain of at least 10% on average after about a month. The problem is that after 3 months and even longer route, it seems that people go back to the same level of pain or even report more pain than they started off with. There are other injectable tools that people will offer, including platelet-rich plasma, which is a treatment that I offer for knee and other joint arthritis. But in my review of the literature, it has really poor success rates for treating tendon issues. And for most people, it's quite painful and is relatively expensive. So it's not the option that I steer people towards. The surgical options include debridement and sometimes reattachment of the tendon to the bone itself. That has about an 85% success rate, where 85% of people say that they notice significant improvements and would repeat the procedure. The improvements in pain often, let's assume you have 6 out of 10 pain, can drop down at 26 weeks and beyond down to a 0.5 out of 10, and that's significant. It's actually very similar, if not exactly the same, as the amount of benefit that we see on average for percutaneous ultrasonic tenotomy. So for equal benefits, why choose one over the other? Typically, compared to surgery, percutaneous ultrasonic tenotomy is less expensive of a procedure, usually ranging about 40% less expensive, and without general anesthesia, you don't have the added expense of an anesthesiologist. Hopefully that's helpful information. Don't be afraid or hesitate to reach out to us. I'm going to make sure my email is visible here, and you can always call the office to set up a consultation. Thanks, everyone.